Welcome to Airway Breathing Conversation, a podcast presented by the anesthesiology residents at the University of Saskatchewan, created to provide individuals of all levels of medical knowledge with anesthesiology-related healthcare information. This episode is part of our Abridged Ground Round series, in which highly knowledgeable and sought-after guest speakers present on a multitude of fascinating topics relevant to anesthesia. Join us for Grand Rounds this week, where Dr. Liam Dowling, a third-year anesthesia resident at the University of Saskatchewan in Saskatoon, discusses the history of anesthesia. Now, whether you are an anesthesiologist, resident, medical student, or member of the general public, come listen in as we demystify the incredible specialty that is anesthesiology, one episode at a time.
My name's Liam. I'm a third-year anesthesia resident in Saskatoon, if you haven't met me yet. And so today I'm going to be talking about probably one of my favorite topics within anesthesia, and that would be the history of anesthesia. I find it very interesting, and ultimately, history is something that I think is very important for people to recognize and remember, because the history of anesthesia is, I think, quite fascinating and quite scandalous in some parts, and I think it's very interesting. And it wouldn't be an anesthesia talk if we didn't have an ABC pun of some type. And so I thought very carefully about sort of the main things I wanted to discuss. And so I've broken down this very, very large topic into sort of three general categories. So we have ancient antics, we'll start with. And then probably the main section, which is battles in Boston, where we'll be talking about the discovery of general anesthesia. And then the last section is sort of more of a catch-all in the last century, discussing things like chloroform, cocaine, and a little bit about computers. If anyone has any questions, just feel to drop them in the chat. I can keep monitoring that and happy to answer them as we go along or right at the end as well. I will acknowledge that right now I'm on Treaty 6. I'm out in Calgary on elective, and that Saskatchewan is based on, or sorry, I think I'm Treaty 5 and Treaty 6 is Saskatchewan and the homeland of the Métis. I will also say that when it comes to historical talks and presentations, and especially within medical history, topics are often skewed or biased towards Western medicine because that is, in essence, the type of medicine that we practice here in Canada. And so I do focus on that, and a lot of historical literature does tend to focus on those topics. But that doesn't exclude the fact that some historical things are sort of not acknowledged within Eastern and Indigenous traditions. So I do try and acknowledge them when they are relevant as much as possible. And I would encourage you that if you find a certain topic interesting, to go out, do your own research, and look into it within different contexts as well. So starting with ancient antics, sort of wanted to do a quote to capstone each thing. And so I swear by Apollo the Healer, which is an important reference if you know it. And so my personal history with history of medicine started back in my undergrad medicine. I went to Queen's University, which is in Kingston, which is a very old historic city. It was the original capital of Canada before it moved just up the river to Ottawa. And they have a dedicated history of medicine program within their curriculum where they have a chair of the history of medicine. This is Dr. Jacqueline Duffin in the picture, but it was Dr. Jenna Healy when I went, and she was very foundational in my love of history. And in our orientation week, we do a history of medicine tour on campus where we go through different buildings and learn about the medical history associated with them. And we finish it with this event, which is our Hippocratic Oath reading, where we meet with candles on the edges of Lake Ontario, and we go through and recite the original Hippocratic Oath. And it's quite interesting, and they very much emphasize that it is the original oath from the Greek, translated into English. And that's relevant because although we think of the Hippocratic Oath as something that's maybe consistent, it's something that's changed over the years. And it's very interesting. So most people, when they think about the Hippocratic Oath, they think about the general principles of doing no harm. And that does appear from this quote that I will do no harm or injustice to my patients. And this comes from a Greek physician and philosopher Hippocrates, which is depicted here, who is often cited as the father of modern medicine. He lived in Greece in the early 370s BC. Um, and is in general known for his sort of formalization of teaching of medicine. And this oath is something that's often done in medical schools, either at the beginning or the end. It's not actually legally binding in any means, but this is what we often think about. But when you go to the original quote, and when I was standing there, there's some interesting things that have sort of changed over the years. So, for example, there's a section that says, to hold my teacher in this art equal to my own parents, where he is in need of money to share mine with him. And I thought this was just a very interesting change over the years of how maybe the perspective of medicine is sort of flipped. And thank you to all the staff that provide us with lovely caffeine in the morning. It's very much changed. And on a more serious note, as we went through the oath, there are some things that have very much been admitted in more modern versions. So there is quotes about not administering poisons or not performing things like abortion for patients. And that goes back to sort of the historic times. And obviously, as medical contexts change and what's considered appropriate and necessary for patients has also changed over the years and over time. One of the most interesting things that I found was this section of the oath. The original oath says, I will not use the knife, not even verily on sufferers of stone, but I will give place to such as craftsmen therein. Um, which is quite interesting. And essentially, what this oath says is that as a physician, I will not perform surgery. I will not do surgery on people who essentially have kidney stones, nephrolithiasis at this point in time, and that surgery is supposed to be left to different individuals, people who have a different skill set at that time. And it's quite interesting because during that time as a first year med student, people kind of just mumble through it. They didn't really know what exactly was going on, but this one always stuck with me because it means physicians didn't do surgery. And I always wondered sort of like, why was that? And historically, we do see that there was this big delineation between a physician and a surgeon. And they were very, very different roles. Surgeries were not often performed by physicians and were performed up into the Middle Ages by individuals called barber surgeons. And this is the historical origin of like barber shops. And that's because they were crafted with physical skills, with using knives and tools. And a very interesting thing is people will often think that the term barber comes from the same root as like barbaric. It actually doesn't. They have different roots, and barber just comes from the Roman word for beard. Um, and so surgeries were not often performed. This was a painting that I found from 1784 depicting a medieval surgery, and it was entitled The Quack. So up until around the late 1700s, surgery was not given the same credence that it is today. It was often sort of looked down upon, and there was a variety of reasons for that, because it wasn't often performed. At the time, there was limited anatomical knowledge. So this is a picture depicting the father of modern anatomy, who was a Greek physician named Galen. He was famous for trying to understand human anatomy, and I honestly think we take for granted how much we know about human anatomy to these days. Historically, it was not considered appropriate to perform autopsies or to examine human remains, let alone do it on a person who was alive. It was considered immoral and sacrilegious. So most of our anatomical knowledge historically came from dissections of animals, such as pigs, which is what is depicted here. For a very long time, we didn't understand how many lobes there were in the liver because we only had our knowledge from other mammals and not actually humans. And so surgeries weren't often performed because we didn't have that anatomical understanding. As most of you can probably imagine, there were generally poor outcomes during this time. There was less sterility, less anatomical knowledge, and it just wasn't great overall. Surgery was often considered a very last resort, and medical intervention was considered much more the mainstream. And obviously, as related to this talk, performing surgery was ultimately quite intolerable, right? It was very painful. We didn't have ways of limiting people's consciousness at that period of time. And so surgery as a field of study didn't really advance for several centuries. And I put up this with the Royal College of Physicians and Surgeons because this historic origin, all the way back to ancient Greece, can still be seen in a lot of our language today. And you can see that. And why is there this delineation between physicians and surgeons in Canada? And it comes from that historic origin that they were really considered separate fields, even back when some of these professional societies were founded. But it wasn't all bad news back in historic times. There were some options in terms of analgesia that are still relevant today. So probably the one that most people would probably think about is the poppy plant, which is depicted here. It was native to Eastern the Mediterranean, and this is where we get our extract of opium, which contains morphine. Morphine, if you don't know, is actually named after the god Morpheus, which is the god of dreams. And as we know in many of our anesthesia practices, opioid-based analgesic is probably one of the most widespread analgesics in anesthesia practice. Some other more historic ones that we think about, and especially in the context of Canada, is cannabis. This is a plant that's native to Central Asia and has active components of CBD and THC, which have some sort of that hallucinogenic, hypnotic properties, as well as analgesic properties that were used in ancient times. I did do some diving into some research, and there's still sort of mixed opinions on whether or not cannabis has good analgesic effect in a variety of different contexts. But obviously, living in Canada where it's legalized, a lot of research is being done here on whether or not it can be used in modern anesthesia practice. Other interesting ones is willow and meadowsweet. So this is a plant that is found widespread throughout the Afro-Eurasian continent, and it has an analgesic component called salation, which is found through its barks and leaves. So historically, a lot of ancient cultures would bite down on bark and chew willow leaves to help relieve pain. And it was actually meadowsweet that was originally used to derive aspirin that we use today. So a lot of the basic medicines that we think of come from plants and were derived, at least in the 17 or 1800s, to find that sort of active metabolite. And there was some Cochrane review looking at herbal medicine for low back pain, which found that salation did improve, at least compared to placebo. And the last one, which I find very interesting, is peppers. So peppers is a plant that's native to the Americas. It's been used by a lot of indigenous populations for analgesia, insect repellents, and they would often use it for breastfeeding weaning. And its active component is capsaicin, which actually has really great evidence for neuropathic pain management. So this is actually the Peer Simplified Chronic Pain Guidelines that are based out of Alberta. And they actually show that capsaicin-based medicines are just as effective compared to gabapentinoids and SNRIs like duloxetine, at least compared to placebo for the management of neuropathic pain. So there is actually some evidence for a lot of these historical practices once we've sort of isolated that active compound. Those are very broad and general approaches to analgesia, and our very earliest record of potential for general anesthesia was a Chinese physician, Hua Tuo, and his ancient chemical mixture. He was a 2nd century, so that would be around the 100s, Chinese surgeon who performed intestinal resections under a state of unconsciousness. He essentially had a mixture referred to as mafation, which was, if you do the translation from Mandarin, translates to cannabis boiling powder. We don't actually know what this formulation looked like. Records were lost. He ended up burning most of his records shortly before his death. And so we don't actually know what he was using, and we can't necessarily verify these accounts. Some people think, based on the name, that it was a wine-based liquid combined with something like cannabis, opium, or a variety of other plants that induced a state of unconsciousness and muscle relaxation in order for him to perform these surgeries. And so, although it doesn't have the absolute official record, this is probably our earliest understanding that people were trying to find a way to perform surgeries in a tolerable manner for patients. And so ultimately, we have this huge gap from like 600 BC in Greece all the way up to like the 18th and 19th centuries, where there was little advancement in the field of surgery. It was very challenging. This here is a picture of Dr. Robert Liston. He is a British surgeon, and I know about him from some of my lectures. He's quite interesting because he is famous for performing the fastest leg amputation, which he completed in 2.5 minutes. You can imagine at that time, that was what needed to be done in order to facilitate the procedure. And we've come a long way in terms of managing these types of patients. And so there's always a calm before the storm. And that brings us to our next section, battles in Boston. Gentlemen, this is no humbug. This is the section where we talk about the very interesting discovery of general anesthesia. And I find this very interesting. I thought I knew the history, but when I was researching this talk, it's a lot more complex than I thought about it. And so essentially what happened was advances in chemistry and physics allowed us to really isolate chemicals and use them more appropriately within a medical setting. And so gas that we still use to this day, nitrous oxide, was isolated in the late 1700s. It was coined as laughing gas by this physicist Humphrey Davy, who's depicted on the slides. And Davy would go around on touring lectures demonstrating the effects of nitrous oxide to his audiences, to much knowledge sharing and much entertainment. And this is a satirical cartoon depicting some of these lectures where it says scientific researches, new discoveries in pneumatics, and experimental lectures on the powers of air. And so very much a history of gas passing goes all the way back to this tradition. Davies was just a physicist, though. He did not do medicine. And he died in 1829, shortly before the official discovery of general anesthesia. But his legacy was not left. And so individuals during the early 1800s weren't necessarily very different from people today, and they would often engage in fun activities on the weekends. Nitrous oxide and ether were widely available, and people could go to their local chemist or pharmacist and get it over the counter. And they could essentially take it home and enjoy some lovely huffing parties, which were referred to as ether frolics, where people would get together and huff ether gas and have a grand old time. And ether frolics were actually very popular amongst medical students. And after a night of misadventures, many medical students would wake up having no memory of the sustaining cuts and bruises, which led some of them to get some very interesting ideas about its practical applications within medicine. And that brings us to our battle over the discovery of general anesthesia. So there are lots of characters involved because they were widely available. People were participating in them. There are several individuals who have been associated with the discovery of general anesthesia. And there's still debate, even to this day, about who should receive credit for this discovery. You can see on the slides, I've tried to organize some of the men that were involved. They all have lovely beards and lovely bow ties, very fitting for the early 1800s. So starting off, we have William Clark and William Morton. So these individuals were undergraduate buddies. They attended undergraduate school together in the Middle East, not Middle East, the Northeast of the United States, around New York and Boston. So they often would participate in ether frolics together. So they knew about some of the psychotropic effects of ether and other gases. Clark went on to become a medical student in 1842, and he is reported to have used ether to aid in dental extractions. However, Clark never published his research. Nothing really came of it. He went on and did other things, and he didn't really pursue anything further. Morton is a name that you want to remember because he'll come up again in later years. But this was maybe our first idea that people were starting to use ether or nitrous for some form of medical intervention. Then we get on to Gardner Colton. So Gardner Quincy Colton was a medical student, and he ended up leaving medical school to become a professional showman, where he would do, similar to Davy, performances with nitrous oxide. And he would do a traveling tour about it. And it was in December of 1844 that this man, Horace Wells, was in attendance to one of his touring shows out in Hartford, Connecticut, where he practiced dentistry. Horace Wells was a dentist. And in that day, Colton brought in one of the audience members and gave him some nitrous oxide and then proceeded to injure his leg. The man felt no pain, and Wells recognized that he could use this gas to perform dental extractions. So he actually worked with Colton over the next several days, providing his patients with nitrous and doing dental extractions out of his practice in Hartford, Connecticut. So this was one of, again, we're starting to expand, and a lot of this was within dentistry, right? Extractions were commonly done just not under anesthesia, and it was how could you facilitate this? And this brings us to humbug. So Horace Wells was actually the business partner of William T.J. Morton. And they started discussing this. And it was Morton who suggested that Wells needed to go and demonstrate his discovery to the world. And so Morton arranged for Wells to go and demonstrate his technique at the Massachusetts General Hospital. On January 20th, 1845, they went to a dental extraction and it ended in failure. And the patient cried out in pain. Although after the fact, the patient said he remembered nothing. So just because he was moving, just because he was crying out in pain, doesn't mean he had any memory. And allegedly, this is actually debated, the audience yelled humbug and said that it was frivolous, scandalous technique. And Wells was actually publicly embarrassed. It actually ruined his almost like his entire career. He never recovered. And he would end up going on to take his own life at the age of 33 at such a young age because of this sort of historical blunder. And ultimately, this is what set the stage for what we know today and most commonly as the official discovery of anesthesia and Ether Day on October 16th, 1846 in Boston, Massachusetts. So this is a painting that was commissioned shortly thereafter to commemorate this day and the discovery of anesthesia. This is a picture of me at the Harvard Medical School library with the original painting. You can actually see it's quite massive. It's probably judging probably about 7 or 8 feet high. We have a version of this in the anesthesia library in Saskatoon. I was able to get in because I had a medical school friend who went to Harvard, and so he was able to sneak me into the library so I could get a photo with it, which was very cool. What's very interesting about this photo is that it is very historically inaccurate, where, as you can see, the person holding the ether in the background or in the foreground doesn't look like Morton at all. He's like very smooth-faced. And apparently there were several surgeons who worked at Mass Gen who are depicted in this painting who were nowhere near there on that day. And so the story of this was that Morton came and worked with one of the surgeons, a Dr. Warren, who's a very famous family of surgeons in Boston, to remove a tumor from someone's neck using ether gas. And this was done at the Ether Dome, which I had the fortune to go and visit shortly before the pandemic started in early 2020. And so the Ether Dome was the main surgical theater at Mass Gen Hospital, and it was located on the top floor. Historically, operating rooms were actually not located in basements like a lot of them are today in Canada. They're located on the top floor because before the advent of electricity, people needed to see what they were doing. And so you can see here they have this lovely dome to bring in light and these shuttered lights, I should say a shuttered window, which was used to help direct light inwards to the operating field. And then as well, you can see there's me with one of the paintings that was commissioned, I think in 2005, which was done to be a lot more accurate. And true to tradition, there is a lovely statue of the god Apollo, which was a reference to the historical roots of medicine in Greece. And to the Hippocratic Oath there. And so Apollo, even back then, which you can see in the background of the painting, was watching over this historical event in history. And so this is the plaque that's actually found in the Ether Dome. This is my picture that on October 16th in 1846, in this room of the hospital, the first public demonstration of anesthesia to the extent of producing insensibility to pain during a serious surgical operation. You can see there's a lot of like specificity there. The first public demonstration of producing insensibility to pain for a serious surgical operation. So not just a dental extraction is sort of the subtext there. So sulfuric ether was demonstrated by William Thomas Green Morton, a Boston dentist, on the patient who was Gilbert Abbott. The operation was a removal of a tumor, as you can see in the painting, under the jaw. The surgeon was John Collins Warren. The patient that he had declared felt no pain during the operation and was discharged a couple months later. Knowledge of the discovery spread across the world, and this was really the big change for the era of surgery. And very famously, Dr. Warren, after the patient said that he had felt no pain, Dr. Warren announced, "Gentlemen, this is no humbug," very much referencing the previous attempt underdone by Wells from a year or two before. And so many people cite this as the first discovery of anesthesia, the first general anesthesia. But then shortly thereafter, there was still a lot of debate. So very interesting, Morton, and this is his etherizer. So basically, this is the device he used. He would put a sponge soaked in ether inside and then hold it near the patient's face. And that would induce a state of unconsciousness. When he was asked, like, how did you do this? What is in this device? He said that he had discovered a very special compound, which he termed lethion. And again, referencing historical natures and historical Greek traditions, lethion is named after the mythical Greek river Leth, which was a river in mythical traditions that caused forgetfulness. But everyone knew that this wasn't the case. They were in the room, they could smell, they all knew that it was ether. And people were very much like, what is he getting on about? This lethion. He's like, no, 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 no. It's not ether. It's lethion. And everyone's like, this is just ether, right? And because of that, it had widespread use. Morton initially tried to patent this chemical, and people called him out on it. And he said, no, 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 I'll leave the patent free for charities and hospitals. How very kind of him. But essentially, he would spend the rest of his life attempting to profit off of this discovery. He would make a claim to the United States Congress that he was missed on financial compensation for his discovery, which was rejected. And he would spend it debating with other individuals about whether or not he deserved the credit for it. Morton died at the age of 48. He ran into a lake in Central Park. He is suspected to have had a stroke at that age. And this is a picture of his tombstone, that he was a dentist and was the discoverer and demonstrator of ether anesthesia, notable contributor to the advancement of surgery, the first public demonstration in Massachusetts General Hospital on October 16th of 1846. However, this is where our story gets a little bit more complicated. Because shortly after Morton's discovery was published, it went around the scientific community and the medical community. This man, a Dr. Crawford Long, said, wait a minute, this isn't anything new. Dr. Long was a physician who worked in Georgia, in the southern United States. And you can imagine information dissemination in the early 1800s was limited to the Pony Express and other forms of manual transportation. And he's basically sat there and said, wait. I've been using volatile anesthetics for years. He has documented reports of him using ether as early as 1846, so as early as 4 years before this public demonstration out at MassGen. He had documented his use of it. He had patients vouching for him. He had informed his local colleagues. But unfortunately, he did not publicly produce his findings. He didn't report it in a medical journal. And so a lot of the credit that maybe he would have gained or deserved was lost because he didn't inform the general public at the time. It was very insular to his medical community in Georgia. And in fact, this is a depiction of him in, I believe, one of the medical schools in Georgia. And it says Crawford W. Long, MD. He is the discoverer of the use of sulfuric ether as an anesthetic in surgery on March 30th, 1842 at Jefferson Jackson County in Georgia. So this is a statue that said, no, 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 no. He was the one who actually discovered it. And this led to a lifelong debate with Morton. Wells was involved. All of these individuals said, no, 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 I was the one who did it first. And it doesn't stop there. Then there was this other man, Charles Jackson, who was a former medical school professor for Morton out at Harvard Medical School. And Jackson, after the public discovery, claimed that he was the one who actually suggested to Morton to use ether as an anesthetic. You might remember that we had Clark, his roommate or like his undergraduate friend, that originally also suggested or used it himself. But Jackson, the moment it came out, was like, no, 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 no. Morton came to me. I was the one who said you should use ether. I was the one who discovered it. Also, very interestingly, Jackson was known for having to have claimed discovery for many different historical inventions, including gun cotton, the telegraph, and the digestive mechanism of the stomach. Basically, the story would be that a medical or these discoveries would have come out to the public, and Jackson would have claimed earlier discovery. But he was very, very passionate about his involvement and discovery of ether. This is a photograph of him with a series of medals that he often wore for photographs depicting him and for his contribution to the discovery of anesthesia. He engaged in many legal battles with Morton. And then apparently he went insane and died in an asylum in the United States, allegedly after hearing about Morton's tombstone. A lot of these individuals did not have great ends, but mind you, it may have been the fact that they were huffing ether and nitrous gas for most of their careers and lives. It's hard to say. As again, very much still, although we have a lot of records of this, it's still quite cloudy about the historical origins. And that's really the big summary of the discovery of general anesthesia as we know it within the United States. And the question is like, who won? And we still debate this. It probably is that all of these individuals had some role to play in the discovery of anesthesia. Clark demonstrating it, Colton bringing the idea to Wells and Morton, Wells actually being the first to try it and had done it several times, but just not publicly. And most people, when we talk about this, will cite William T.J. Morton as the discoverer of anesthesia. However, most scholars would probably emphasize that with a caveat, where they say Morton is the one to have the first successful and public demonstration to sort of push away Wells, Jackson, and Long in terms of their claiming of the discovery of anesthesia. And that's why even on that plaque within the Ether Dome, you saw that it was very much emphasizing that it was the first successful and public demonstration. And that's where the big differences are there. And we see this all the way into how we commemorate ether. So this here is some images of the Ether Monument. The Ether Monument is one of the, and if not the oldest statue in the Boston Common, which is a public park, which is located just about 10 or 15 minutes down the street from Mass Gen Hospital. Again, when I went to go see the Ether Dome, I was able to come here and see it. And there are some great quotes on it. So they have a quote from the book of Revelations from the Bible, "Neither shall there be any more pain." And on it is this quote: "To commemorate the inhaling of ether, that the inhaling of ether causes insensibility to pain, first proved to the world at Mass Gen Hospital in Boston, October, the year of our Lord, 1846. But what's very interesting is they have this quote, but William Morton's name is nowhere to be found on this monument. And in fact, if you are able to see the screen, there is a picture of a figure at the top of the monument. And this is depicting a medical doctor in the pose of what is known as the Good Samaritan. So, someone helping an ailing person. The individual is holding a cloth likely to represent ether and holding it near the patient's face. But what's interesting is the sort of the clothing that this individual is wearing. It doesn't look like those suits and bow ties that men in the 1800s in the United States would wear. It's actually a medieval Moorish Spanish robe. And this is a depiction of something that has nothing to do with Morton. And this was actually done deliberately. This monument, when it was commissioned in 1868, the debate on who discovered anesthesia was still ongoing. And so the person who commissioned it and the artist decided to stay out of the debate and did not put Morton's name on it and made a general depiction of a physician that looked nothing like the claimants on top of it. And basically, this was a monument to very much demonstrate the role and the importance of the discovery of anesthesia for humankind and the advancement of us as a society. So if you are ever in Boston, be sure to come and check out the Ether Monument just down the road from Mass Gen. Now, the last caveat is all of this was happening in the United States during this time. And it's quite interesting because, like I said earlier, a lot of medical history is skewed towards Western medicine. But that doesn't mean things weren't happening in the rest of the world. And so during this time period, it was the Edo period of Japan, which was when Japan as a country was very isolated from the rest of the world. They were closed off. They didn't allow many imports or exports, and they didn't allow immigration. And so a lot of knowledge during this point wasn't disseminated to the rest of the world. And actually, in 1804, surgeon Hanakoa Seishu performed mastectomies under general anesthesia using plant extract compounds. And people will actually regard this as the first reliably documented operation under general anesthesia. So this was going on while everyone was having their battles off in the United States. And so maybe it wasn't even Morton to begin with. Maybe it was somebody else who discovered anesthesia. Mind you, maybe the new caveat is that Morton was the first to publicly and successfully demonstrate the use of a volatile anesthetic as opposed to any anesthetic at all. And so the big conclusion is that history and discovery is very messy, and it's very rarely the discovery of one person. And a lot of what goes into medical practice as we know today is about collaboration and general knowledge dissemination. And that brings us to our last section, chloroform, cocaine, and computers. And just a little pressure now. So the word of volatile anesthetic spread across the globe, with many physicians becoming more skilled in its practice. There was ether, there was nitrous, and then shortly thereafter, chloroform became much more popular. The States was known for its ether practice, and the United Kingdom was known for its chloroform practice. And one of the country's foremost experts was this man, a Dr. John Snow, not of Game of Thrones fame, but of anesthesia and epidemiology fame. He's depicted up in the right corner. And he was the foremost anesthetist in the country. Interestingly, he is actually not just known as one of the pioneers of anesthesia, he is known as the father of epidemiology. This is one of my favorite topics, and if you ever find me in the OR, I will happily talk to you ad nauseum about the discovery of germ theory and the history of epidemiology and biostatistics. He was very famous for what was known as the Broad Street pump case, where he began charting cases of cholera in downtown London. Cholera at this time, as we know, is a waterborne disease, but they didn't know that in the mid 1800s. And so what Snow did was that he plotted out cases of cholera around this local community. And he found that there was an increased incidence and a clustering of cases around a pump on Broad Street. And so he devised that likely it was a waterborne illness, and he advocated to his local community to have the Broad Street pump removed, and you can actually still see it there if you go to Broad Street in the United Kingdom. Also, very interestingly, is that right next door to the street was a brewery. And the brewery had zero cases from any of its workers, likely because they were only drinking beer and not any of the polluted water. And the relevance for Dr. John Snow is that not only was he the father of epidemiology, he is often cited as the father of obstetrical anesthesia. Historically, analgesia for laboring women was not considered appropriate. It was either considered unethical because of potential concern over risks to the mother and to the infant. And within many Christian traditions, it was considered not appropriate to give women pain relief during labor. But despite this, John Snow successfully used chloroform on Queen Victoria, who is the Queen of the United Kingdom and the head of the Church of England, for the birth of her eighth and ninth child in 1853 and 1857. And basically, very much so, because it was good enough for Queen Victoria, a lot of the naysayers couldn't say much because she was the Queen of England. And practice of analgesia for childbirth started to disseminate through the aristocracy and then eventually down into the general population. And this was really the start of obstetrical anesthesia as we know it. More specifically, we get into the discovery of local anesthetics, which become relevant for the practice of obstetrical anesthesia as we know today, and the cocoa plant. This is a plant that's native to Western South America. Its leaves contain extract that can be isolated into cocaine, which was first, in 1855. But indigenous populations knew about the sort of the properties of the coca plant for centuries, if not millennia before that, and would often chew on coca leaves for a variety of medicinal purposes. But ultimately, that's what led us to the discovery of spinal anesthesia, which, as we learned from Ether, any sort of medical discovery these days, at least in this time period, it was marred with a lot of debate and discussion. So we have a Dr. James Corning, who was the first to inject cocaine between the spinous processes to provide some analgesia and insensation to pain. It is still debated to this day if he actually performed a spinal anesthetic or an epidural. And the reason being is that the doses that he used were quite high, and he didn't describe the flow of CSF back. And so because of that, he is kind of dismissed in history as not having discovered spinal anesthesia. And a lot of the credit goes to August Beer of the beer block fame, who is probably credited with discovering of spinal anesthesia, where he used a cocaine spinal for an ankle surgery on a patient with tuberculosis who he believed would not tolerate a GA. And it's actually quite interesting to see how spinals are often considered an alternative to GA. And we talk about that in our medical practice today. And that comes from historic roots still to this day about how spinals are options for people who would not tolerate a GA. He performed this on a patient and several other volunteers. And then he began experimenting on himself. And notably, his assistant failed to attach the syringe of cocaine effectively, and he had a massive CSF leak, and he reported to have had a very wicked postural puncture headache. At this time, the gauge of the needle was quite large, and so one of the side effects 100% of the time was a postural puncture headache for a spinal, but for these people, that was better than death. That would have resulted without the intervention of the surgery. And so this led to an advent of a different type of anesthesia and ultimately led to the birth of the cesarean section. I could do an entire talk on the history of obstetrics. And again, if you see me in the operating room and you want to chat, the history of obstetrics as a field is also one of my favorite topics, so I can yap at you for a long time about that. But a cesarean section, as you can imagine, was historically not a great option. For the vast majority of human history, cesareans were only used in the last resort where the life of the mother was already expected to not continue, and it pretty much almost always resulted in the death of the mother. A lot of people think the term cesarean was named after Julius Caesar, but this is probably not true. As we know from history, Julius Caesar's mother was alive well into adulthood. And so because of that sort of 100% mortality rate, most people do not believe that Caesar was born by a cesarean, and that the term cesarean comes from a root having to do with the term cutting. And so there's individual records of cesarean sections happening from time to time with some people living, but some of our earliest records of successful C-sections with anesthesia were actually from the Great Lake regions of Africa. So that's, I believe, around Uganda. And this is what this picture is depicting here, which were eventually disseminated out to Europe during the mass expansion of empire and colonialism in the 1800s. And so they used a concoction of banana wine to help produce some level of analgesia and unconsciousness, and successfully cleaned the area with water and alcohol to help reduce the risk of infection. And caudal anesthesia was first used in 1942 to allow a woman with rheumatic heart disease to deliver. That was probably our first record of some form of continuous infusion, at least in a caudal block. And there are later reports around the 40s and 50s of using epidural anesthesia in a continuous manner. And again, it's interesting to see how even back in this time, we still knew about the effects of things like congenital heart disease and rheumatic heart disease, and the role that and the risk associated with a general anesthetic. And ultimately, the last century, as you can think about it, really has to do with the further invasiveness of anesthesia and the progression of technology in anesthesia. You saw earlier the original depiction of ether was just having it in a bowl with sponge and pouring it over the patient's face. But as surgical techniques got more complex and our technology began to advance, and our chemistry began to advance, it allowed for a level of precision. And so this is really much in the advancement of anesthetic delivery systems. So that's imagining going from just pouring a little bit on someone's face all the way up to what we have now in terms of end tidal control and vaporizers to get specific amounts. We've had advancements in ventilation systems. Again, I don't have enough time today, but the advancement of airway management went all the way from the tracheostomy as the only option to where we have now fiber optic based intubations. It's been a huge development over the past centuries. And then we have improved medication with more specific devices. And the images that I have here are depicting some of those changes. So the first one up there is what's known as an ether mask. And so what they would do is this was essentially a cheesecloth that they would soak in ether and tighten it between this and hold it over the patient's face until they went unconscious. And if the patient needed a bit more, they were moving a bit, they had a vial of ether and they would just drop it onto the cheesecloth to get it a bit more concentrated. Below that is a depiction of Dr. Brain's initial prototypes of the laryngeal mask airway in the 70s and 80s, which has come a long way. If I remember in my readings correctly, Dr. Brain has since sold the patent and his company for that, making a lovely over $200 million for his discovery, much to Dr. Morton's dismay. And then on the right is, as we know, video-based intubations and the advent of video technology in what we do. And ultimately, the discovery of anesthesia and the progression nowadays has to do with how do we get technology advancing into our practice? And basically, technology and computers have greatly improved our accuracy and safety for anesthesia, especially compared to the idea of just pouring a little bit more ether when they need. And a lot of our modern delivery systems can target anesthesia agents in a closed loop manner. As I mentioned, we have our end tidal control. And a lot of people are still speculating about maybe someday we will have sort of a self-regulating anesthetic machine where we won't have the need for an anesthesiologist because there will be a closed loop with anesthetic requirements either through EEG monitoring or some other metric. I don't think we're there yet, but this is something that I think some people are looking at. And I don't think it would be a history lecture if we didn't talk about the future. And so in my research, there was an interesting article I read about the Icarus paradox. And again, going back to our sort of original Greek historic roots. And the Icarus paradox, for people who don't know, is basically this concept that a business ends up failing as a result of what made it successful in the first place. The story of Icarus is about a father and son who created wax-based wings that allowed them to fly over the water. But Icarus had a lot of hubris. He was very overconfident, and that made him fly too close to the sun, causing the wax on his wings to melt, and then him to plummet into the Aegean Sea. And so this article, when I read it, was talking about how our advancements in safety and technology has made anesthesia much more widespread and causing anesthesiologists to take on a less direct role compared to our historic roots, right? We think back to the early days of ether, an anesthesiologist was always present, providing that anesthetic. And it asked the question of where will we go from here? Will there become a point where anesthesiologists are no longer needed because of closed loop control, because we made our practice so precise and so safe? It's an interesting read. I've left the link there. I don't know if I have a specific opinion on it, but I think it's important to think about how far we've come in the journey of surgery and the journey of anesthesia. And ultimately, what people say in this article is that will our overconfidence in providing anesthetics lead to less safe practice, and maybe we'll have to revert back to maybe where we were historically. It's hard to say. So ultimately, the summary of this is that we have many historical traditions within medicine, and some of them date back thousands of years and have influenced how medicine is viewed and practiced even in our modern day. And history is very, very complex. It isn't necessarily one set of truths, and that many people are often involved in the discovery of different practices, and it's never one person's sole scientific achievement. And historically in anesthesia, a lot of these discoveries were done for the greater good and spread around society on a sort of pro bono basis. And the last thing that I sort of took away from all this is that anesthesia as a specialty has been open to embracing new traditions, new technology and techniques, ultimately to improve safety and experiences for patients, and really has been on the forefront of revolutionizing medicine as a specialty and practice from the very beginning. Anesthesia is what really has pushed us forward. And I often say the history of surgery really is the history of anesthesia first.
You've been listening to Airway Breathing Conversation, a podcast hosted and presented by the anesthesiology residents at the University of Saskatchewan. Please note that while this podcast is run by healthcare professionals, it is intended for educational and entertainment purposes only. We are very thankful to our guests for taking the time to share their wisdom with us this episode, and a very special thanks to you, our listeners, for tuning in. Don't forget to follow us and our associated USask Anesthesia accounts on social media. You can find all our social media links on our Linktree page at linktr.ee/abc_podcast. You can also find the department's social media links on their Linktree page at linktr.ee/usask_anesthesia. We'll see you next episode, but until then, stay calm, take a breath, and always remember your ABCs.